two, three.
So the chemicals affect the sperm. Does it affect the eggs?
Absolutely. Absolutely.
Okay, so the quality of the eggs go down.
Yeah.
What's the exact scenario for the women from what you just said? If you're looking at the eggs, are the eggs decreasing in their normal ways? Does it make them less penetratable? Does it make them come because again, we talked about ovulation. I guess we don't always produce one egg a cycle. Is that what happens too?
Yeah, as you get older, you don't produce the eggs all the time. So then that's when why your periods start getting irregular before
Right.
menopause, because
Okay.
it's the ovulation that makes the period occur.
Hmm.
So yes, and that is the number of eggs, but of course the quality also decreases. But we don't have a measure of quality in a live human woman. But let me take the example of IVF. In IVF, they extract the woman's eggs and they extract the sperm and then combine them to fertilize and put it back in the woman. Well, now they're using artificial intelligence to photograph the eggs, and AI, by looking at the shape of the cell wall, the consistency of the cytoplasm, the nucleoli, AI can predict how likely this egg is to be fertilized.
Welcome back to the Transform Your Mind to Transform Your Life radio podcast and television show. I'm your host, Life Coach Marina Young, and sitting in the guest chair today is Dr. Marina Siri. And we are going to be talking on the topic restoring fertility, trusting the body, and healing reproductive health naturally. Welcome, Dr. Marina.
Thank you. Thank you for having me.
You're very welcome. All right. So let's give an introduction. My guest today has devoted over 3 decades to helping women understand, protect, and restore their reproductive health. Dr. Marina Siri is a OB GYN educator and author of Optimize Your Fertility Naturally. Known for bridging modern reproductive medicine with holistic lifestyle based approaches. She's taught the future physicians at the University of Ottawa, walked alongside countless couples through infertility, and speaks boldly about declining fertility rates and what women can do right now to protect their future health. This conversation is about knowledge, empowerment, hope, and learning to partner with your body instead of fighting it. Yeah, fighting never works, right? On any level, right? You've got to learn to align and partner. So I love it. All right. So as we dive in, Dr. Marina, after more than 30 years in OBGYN practice, what patterns did you begin to notice in women's reproductive health? And how did those observations shape your holistic approach?
So, my observations are similar to what any physician who's been in practice for a long time is seeing. People are getting sicker and sicker. There's more diabetes, there's more obesity, there's more autoimmune disease. And in my profession, that affects fertility. And in particular, I'm seeing more women with endometriosis, which is a painful condition that can affect your fertility. They're also having more polycystic ovarian syndrome, which is a condition that affects the regularity of your cycles and also your fertility. So that is happening at greater rates than before, and couples are having a lot of trouble getting pregnant. The other problem or issue is that women are delaying having children because they want to establish their careers and they want to establish themselves financially. Having children is a very expensive proposition. So we can understand where all of that is coming from. And But it's very, very sad to see people struggling to such an extent.
Yeah, I mean, I've had a couple of conversations about fertility on the show. I have watched a documentary on Netflix about infertility. I have had personal experience with friends in my life that have problems with infertility. And it looks like, when I was growing up, you know, and I'm in my 60s, so let's age myself. When I was growing up, you would hear women, oh, I had sex one time and I'm pregnant. It happens. I think it happens to my mom. You know what I mean? So yeah, we were extremely fertile, right? And
Mhm.
now the opposite had happened. Now a lot of people blamed the pill. A lot of people blamed, so no, you've just introduced, well, yeah, endometriosis, but I mean, are you seeing that that is really because how many people have endometriosis? Um, uh, I don't think a lot of people have it. I mean, what is the percentage of women that have infertility problems due to endometriosis? Why do I can't say that word? Endometriosis,
Endometriosis.
and that other thing that you've just mentioned, the poly something.
Polycystic ovarian syndrome.
Right, right. What is the percentage?
The quoted figures are not, don't seem large. They say 10 to 15%. But the
Yeah.
problem with both of those conditions is that they're very underdiagnosed.
Mm,
And studies show that it takes 7 years for the average patient to be diagnosed with endometriosis, which means they have lack of treatment for that period of time. They don't realize that they may end up having fertility problems. And it also means that probably the numbers are much bigger than we think. And, when I look at my practice, I feel like almost 100% of women have it because I see so much of this. And, obviously I'm seeing people with problems and issues. So it's not an exact figure, but these things are getting more and more common than they used to be. And definitely they're associated with lifestyle. We know that polycystic ovarian syndrome is associated with insulin resistance and obesity,
mm.
and we're seeing a lot more of that. And that's due to a number of things, like the food we eat, the fact that we're sedentary, but also chemicals that we're exposed to in the environment are larger and larger factors. And that's something that's not talked about in conventional medicine because conventional doctors have no idea how to deal with it. So that's really something that comes from the functional medicine world and naturopathic world, which I got very interested in over 20 years ago because of my own health. And that's really changed my perspective about looking at disease in general, how to approach disease, because they have a roots cause approach. They try to figure out, why is this happening? Not just make a diagnosis and give it a pill or do surgery, which is what conventional medicine does. So I think we need to look more deeply at things. And it's really no surprise, we know our lifestyles are bad, but we need to think more about how we improve it because it's doable.
Yeah, I mean, this insulin resistant thing is coming up in more places than I expected. Um, I had a conversation recently with somebody, I don't remember what it is, but I was quite surprised. Now you're putting it in the bucket of infertility. And yeah, I mean, there's so many, well, again, um, insulin resistance happens more often when you get into your third quarter, which is in the 60s or something. And we're talking about women here that are in their 30s, 20s. I don't know if it goes back to 20s, but definitely that 30
Yeah, we're seeing
span.
teenagers with
Insulin
insulin resistance
resistance.
and type 2 diabetes. It's
You're
shocking.
kidding. Wow.
It's
Okay. All right. So everything is getting younger and younger and younger. Now, one
mm.
of the things that well, before I go on to that, now you didn't add the pill in there at all, or you don't think the pill is a culprit?
Hey, ladies, it's your girl, Myrna, so excited to be here. I'm so excited to share all my recent finds from Quince. These pieces are absolutely amazing. Today, I will be sharing with you My top 6 favorite finds from Quince. If you want to find these same pieces, head over to quince.com/shyam now and get free delivery and 365-day returns.
Actually, no, I don't think it's a huge culprit of infertility problems itself. And in
Wow.
fact, it may actually be helping some women with endometriosis by keeping it
Right.
from flaring up. Though
Right.
I prefer medications without estrogen because estrogen actually makes it flare and progestin, it calms it down. And most pills have both.
Hmm.
So, but they work because the progestin is stronger usually. But,
Okay.
my approach would be not to give estrogen at all in that situation. And I don't like giving the pill as a treatment because it's not a treatment. It can cover up what's going on underneath and
Mm.
cover up the problem. And then a woman doesn't even realize she has a problem. If she's put on the pill at age 18 for painful periods
Yeah.
and stays on it for 20 years and then goes off, the problem hasn't gone away. It's still going to be there. And then she'll
Mm.
have to face that at the age of 38 when her fertility is lower because her egg count is lower. Women are born with the amount of eggs that they're going to have for life. They're never going to get any more. They're only going to get less. So that's where age is an important factor.
Yeah,
Unfortunately.
yeah. And that's what I was going to get to before I asked you about the pill thing. Well, yeah, because I always think that it was the pill because you're right. Women are going on it earlier. A lot of women are sexually active, not even for painful period. My daughter was put on the pill for a painful period, and develop a blood clot. She can't take it because of that progesterone. So it's even, she had to use different form of birth control, like the IUDs, because she can't take the pill because of the progesterone. It gives her a blood clot. Now that's a very small amount of people that happens to. But yeah, but again, some girls are, I had some adopted girls that they went to Planned Parenthood without the parent, and they put them on the pill because they were sexually active, right? So they
Mhm.
put them on, and you need to because you don't want them being pregnant. So I always
Absolutely.
thought that the pill was the reason, but wow, again, misinformation, more information. But I was reading a book, and it was really Rebel Wilson wrote a book, and I'm not sure what drew me to the book, but I read a lot, and there was an autobiography, and she was talking about when she wanted to have a baby, and she went into she went to this doctor, a fertility doctor like yourself, and she was overweight because she is the one of the girls that got famous because she's like 250 pounds, I guess. So she said, the doctor said to her, well, you would have a better chance if you weren't overweight or you were healthier or something like that. He didn't use the word overweight. He said if you were healthier, and also said something about her probably needing to buy eggs because her eggs are geriatric. And she said, what? I'm 35. Can I have geriatric eggs? And recently I was talking to my doctor about it, because he got married and his wife is 37 and got pregnant within 3 months. And I'm saying, how did that happen? And he says, yes, he said exactly what you just said, that women are born with a finite amount of eggs, and you know what I mean? And it is geriatric at 35, but I don't know. She was just lucky, I guess. Or maybe because he's a doctor, he helped her out somehow. But yeah, he was only married
But
a year, and he was going to have a baby in a couple of weeks after I talked to him. So she must have gotten pregnant 3 months in, and a year in, they had a baby. So, but yeah, so that's amazing to me because I always thought that you can get pregnant until your period stopped. So,
you can,
so
you
let's talk
can.
about
And
that. Right, go ahead. Mhm.
so you certainly can, as long as you're having periods, you are ovulating and you can get pregnant, but you're not ovulating as consistently and the quality of the eggs is worse. So your chance of getting pregnant just decreases significantly. In 35 years, the oldest patient that I had who had a spontaneous, healthy pregnancy was 48. And she was very well counseled about this because, I talked to her about the potential problems and so forth. And she had a really healthy pregnancy that was planned. But I want you to think about this. you know people who age very differently. I'm sure you know a 60-year-old, one who looks 40 and another one who looks 80, right? People age very, very differently.
Yeah.
It's the same with your eggs. The quality of your eggs change with time. And if you are healthy and looking after yourself, the quality of your eggs will improve and they will be more fertile for longer. So that's what I'm trying to tell women who are delaying. I totally understand delaying pregnancy. I did it myself, but the next generation is doing it even longer than, this generation did it. If you want to delay, that's great. But what you need to do is improve your health and improve the quality of your eggs by lifestyle. And then you will be able to have children later in life and be healthier.
Well, that's good news because, I thought they were lumping it all in this bucket. At 35, you've got geriatric eggs, and you need to buy eggs if you want to be pregnant.
Well,
So
that's sort
you're
of
coming in with some new information, which is good. Go ahead.
that's the mantra of the IVF clinics. They treat everybody like they're the same, and we're not. We're biologically different. And you have to take that into account. It's like, people respond to medications very differently. It's because they metabolize them differently. And yet, conventional medicine gives everybody the same dose. We are now in the area of personalization. We can do genetics. We can figure out how you respond to medication and tailor the dose. That's not being taught in medical schools because the pharmaceutical industry does not want to go there. It
Right.
is, they want to have the same dose for everybody and not have to, get into this personalization business. Mind you, they are doing it in oncology because it is working and they're making very expensive drugs in oncology that are tailored to your genetics.
Mm.
So, it
This is
is
for cancer,
eventually
right?
for
Right, right,
cancer,
right. Mhm.
but they're only doing it. Well, I maybe I shouldn't tell you why they're doing it, but my feeling is because there's money to be made there.
Of
That's what
course.
drives the system.
Yeah.
And, if there's not money to be made, like for instance, in improving pregnancy outcomes with your genetics, nobody's going to talk about it. The thing is,
Mm.
it's there. Things are changing. There's more information. People need to know.
Yeah, there's a lot of big stuff coming down the pipe with as far as longevity. And I love it. I mean, I've had a lot of guests on the show talk about all these new things that being discovered and things that they can do for, longevity. One of my guests talked about natural killer cells for cancer, how they can do that. And
Mhm.
yeah, cancer is very expensive. I remember when my daughter, my not my daughter, when my sister was diagnosed with cancer, they give her a bill of $200,000 for treatment, and then her insurance wouldn't pay for it.
Yeah, yeah, that is.
Yeah, her insurance wouldn't pay for it. Yeah, so cancer is very expensive. So if they're making specialized drugs, it's probably 400,000. So that's where the money is. Yep.
Yeah, for
Yeah.
sure, for sure. So I'm lucky I'm in Canada and pretty much everything gets covered eventually. The more expensive drugs, it takes longer and sometimes they aren't covered initially, but they eventually do get covered, especially when they start making generics and cheaper ones. So we don't really see that kind of situation, but still, medicine is a very expensive deal, and our system is falling apart because it can't pay for it all.
Yeah, 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 yeah. Well, we're Canadians, and my sister actually had to go to Canada to get treatment because,
Okay.
like I just said, that she's alive today because she's a Canadian, and they looked after her very well there. So we're
Good,
yeah,
good.
we're dual citizens, and yeah. So all right, amazing. I'm speaking to a lot of Canadians recently. Yay. Yeah, my last guest was in Mississauga, which is where I'm from. I'm thinking, wow, you're narrowing it down.
Yes, absolutely.
Where in Canada are you?
I'm in Ottawa.
You're in Ottawa. Okay, nice. Okay. All right. So, what do you think are the biggest global declines, the reason for the global declines in infertility? I mean, is it anything outside of what we just talked about? We talked about the fact that your insulin resistance and problems with your uterus, whether it's endometriosis or that other one. Um,
Mhm.
what else is there?
Well, I think that I did allude to the fact that chemicals are a problem. And I actually think this is the elephant in the room because it's affecting all of us. For instance, do you know that men's sperm counts have gone down by more than 50% in 2 generations?
Mm,
And they continue to decrease, I think, by 1.4% every year. So they're saying, by 2045, 2050, men's sperm counts are going to be nil or almost nil.
wow.
Um, and when you look back at the WHO, the World Health Organization has published from 1980 on what sort of normal sperm counts for men are. And when you look at what's happened in 1980, 80% of the sperm that you would look at under a microscope were normal appearing. Now the average is 4%. So they have become more and more abnormal looking. Dr. Shana Swan wrote a really great book about this in 2017 called Countdown, and she's the one who sort of first alerted the world to this problem. And she believes it has a lot to do with the endocrine disrupting chemicals in our environment. Sperm are actually very sensitive little beings, and they don't respond well to chemicals like phthalates, which are found in plastics and in fragrances. Um,
Mm,
so that's part of it. I mean, I'm sure all of lifestyle has to do with part of it because we know that sperm counts go down when you're sedentary. They go down when you're eating junk food. They go down even when you're watching TV too much. So they are sensitive. And even though that you think there's an unlimited quantity because men keep producing, right? But if they're
mm,
producing at less normal sperms at lower rates, it's going to affect fertility big time.
mm. So, so the chemicals affect the sperm. Does it affect the eggs?
Absolutely. Absolutely.
Okay, so the quality of the eggs go down.
Yeah.
What's the exact scenario from for the women from what you just said? If you're looking at the eggs, are the eggs decreasing in their normal ways? Does it make them less penetratable? Does it make them come because again, we talked about ovulation. I guess we don't always produce one egg a cycle. Is that what happens too?
Yeah, as you get older, you don't produce the eggs all the time, so then that's when why your periods start getting irregular before
Right.
menopause because
Okay.
it's the ovulation that makes the period occur.
Hmm.
So, yes, and that is the number of eggs, but of course, the quality also decreases. But we don't have a measure of quality in a live human woman. But let me take the example of IVF. In IVF, they extract the woman's eggs and they extract the sperm and then combine them to fertilize and put it back in the woman. Well, now they're using artificial intelligence to photograph the eggs and AI by looking at the shape of the cell wall, the consistency of the cytoplasm, the nucleoli, AI can predict how likely this egg is to be fertilized. So that
That's
that
going to
is
save women hundreds of
that
thousands of dollars because
yes.
that stuff doesn't even work.
So that's a measure of egg quality, and it's being used now in picking which eggs should be used in IVF.
Nice.
Imagine if we could do that in a woman and look into her ovaries and say, oh, here, I see you have some good eggs, some bad eggs. Let's use this one. Well, that's not doable at this point, but who knows?
I
Things are
don't think
changing
that's
so
ever
fast in our
doable.
world. There might be a way of scanning your ovaries one day and saying, okay, this is good. I have some good eggs.
Wow. Wow. Yeah. Yeah. Yeah, because you know, I have this crazy story of I'm not even sure what's going on now, but there's this girl that wanted to be pregnant for a while. She's been married for a long time, and she decided that she was going to borrow money and get IVF. And then they did the IVF. They actually implanted two of them, and then the babies died. And now she's got to pay back that loan. And I don't know if they were ever going to try to go again. I have to find out, but yeah, the documentary that I mentioned that I watched on Netflix has, informed the world that that IVF stuff doesn't work now. It's very low
Well,
risk.
the thing is, I don't think, women who are so desperate to get pregnant, it's not always explained to them. They think that IVF is successful all the time. No, the
Yeah,
truth is that each cycle is about 30% chance.
yeah,
It
that's
depends
what
on
I
your
heard.
age and
Yes.
other factors. So on average, women need 2.5 cycles to have a healthy pregnancy. So, now our government, for instance, is starting to support women because they realize there's a crisis going on with, we're not going to have a workforce in 30 years to support
Yeah,
our country.
wow,
So
that's
now they're
good.
saying, okay, we're going to pay for one round of IVF. But if you don't get pregnant in that round, and chances are 70% that you won't get pregnant, that hasn't really helped. So, what I'm saying, why don't you teach people that their general health, what they eat, how they move, how they deal with stress is so important that they should be focusing on that and not try to do some technological answer that really doesn't work all that well and costs thousands of dollars.
Yes, sometimes hundreds of thousands. Yes, I mean,
Yes.
like I said, the people in the study, the Netflix study. I mean, a lot of them, went through a lot of IVF and didn't work, and then they moved on to other things, fetal implants and surrogacy and adoption. But yeah, that was they're trying to say that, yeah, you sometimes you want to carry the child, so you're doing the IVF because that's your what you wanted to do. But then,
Mhm.
whatever. And you're right. It's the eggs and the sperm that is the problem. The sperm is probably not as good, and the eggs are not as good. And I don't know what else they do in those petri dishes that are making it. But the sad part was the fact that, yeah, even when you get a successful, what implantation, then sometimes the babies die. So there's obviously something else going on there.
Mhm.
But yeah, but yeah, I mean, we want to give hope, which is what this conversation is about. We want to give
Mhm.
hope because it is one of the top things for women, and especially there's something goes on in your psyche that, you might say, I never want to get pregnant. It's not for me, right? But the minute you say, I want to have a baby and you can't, it becomes your 100% focus.
Absolutely, absolutely, and it's a very stressful experience, and it
Yes.
affects couples. It's a very, very hard experience. But women don't feel that they have any power at all. And what I'm trying to say is, you you have so many ways that you can improve your health. If you look at what you're doing in your lifestyle, just analyze it. And there's a lot of evidence that this works not only just for health and longevity, but fertility as well. I'm also very, very interested in longevity. I attend lots of longevity conferences and have for 25 years. I'm what I call a longevity seeker. I hope to make it to a
Me
healthy
too.
120. So, so you do the same stuff basically for
Yeah.
longevity and
But
fertility.
but but we talk about well, yeah, right. I mean, I was just about to say that, we don't talk about longevity until we're over the childbearing age, but maybe they should start, which is, my daughter is 36 and I keep telling her that you got to start now. Because I don't know if you read Dr. Peter Attia's book. He's saying that it starts 20 years from now. It's not, you don't wait until you're 60 and talk about, oh, I want to live to 80. You start in your 30s so that when you're 50, right, then you're not starting to have these chronic conditions that come with age. So, all right, so this is a good segue into your work because you talk about optimizing your fertility naturally. And you have integrated cutting edge research with natural strategies. So, what are the top evidence based lifestyle changes that most people do to improve fertility outcomes? And when should they start? I mean, if you're at 35 and want to get pregnant, is it too late? to start these
No,
lifestyle changes? Because you only got
no.
like 5 years until you're 40.
I think you can make significant change even in 3 months. But I would
Oh,
say,
really? Oh, wow.
if you're planning a pregnancy, I would say a few years would be even better. Because
Okay.
especially if you have a problem like polycystic ovarian syndrome, because fixing the irregular periods, there's a lot of supplementation that needs to take place, dietary change, increase in movement, and those things take time. You know, any habit is you have to develop the habit, and it takes time. So I think, first of all, that young women in high school should be better informed. Instead of worrying about teen pregnancy, they should be informed about the whole fertility issue, about the
Mm,
fact that what they're going through now may affect their fertility later. They should be aware of that. And they're
mhm.
not. They're not being told those things.
Hmm.
I'm not saying it's not important to prevent teen pregnancy. I think it's very important, but that shouldn't be the total focus of our education for young women. Young women need to know how their bodies work, how to learn the rhythm of your body, how to interpret what's going on, and also to realize that we cycles are normal and we're going to have changes due to the cycle that are going to be there, and some of them are not always fun, but the better you know how to expect it and deal with it, the better prepared you are.
Yeah, so what are some of the natural things that you teach people, especially in your book, that they can do?
So I go through all of the things that we do in life. Okay, the most basic diet. We all know good diet is important, but do people realize that they did a study of women who eat fast food? Women who eat more than fast food more than 4 times in a week have significantly lower fertility rates.
Mm.
We sort of take fast food for granted. Oh, it's not the healthiest, but it's not really going to affect us, right? It has a huge effect. Um,
Well, it has a huge effect because they all get fat because the fast food is what's fueling the obesity. So yes, it's bad for you.
yeah, yeah. So it's not, it's the sugar, it's the chemicals. There's so many chemicals in processed foods. So really we have to try to get back and eat more whole food, more natural food, more vegetables. A lot of our meat is unhealthy. It's tainted with chemicals and antibiotics and hormones. That goes into our bodies. It's going to affect us. We have to be more discerning about what we put in our mouth. Also, the standard American diet is just very, very imbalanced in terms of there's too many carbs, too little protein. People need to know more about what it takes to run a healthy body. We should all come with an owner's manual. It should come out of the uterus with us, like learn how to.
Well, let me tell you something. They're even if you had an overdose manual, they're not going to read it.
That's that is the problem. Not enough. Well, there seems to be two camps, right? People who are super interested in their health,
Yes,
and these
yes.
are the people who are the
The seekers like
biohackers.
you. Yes.
Yes.
Yeah.
And then the other people who think that it's not important at all. And it's
Yes.
interesting because there's so many doctors in that category because they weren't taught that it's important.
Yes.
And it's you only have to think about it for 2 seconds to realize that what you put in your body is important.
Yeah. Yeah. But a lot of people suffer from laziness. That's basically what I think the problem is that they don't they don't want to put in the effort to do
Mhm.
anything. Women or men or whoever don't want to cook, so they go to the fast food. You live in Ottawa, it's cold there. That's why I left
Mhm.
Canada. I'm in Florida. It is, we had a cold spell for the last little while, but traditionally, it's 80-degree weather here and people don't walk. They don't walk. They don't,
I know, it's so
I mean,
funny.
it's laziness. It's like they
Yeah,
don't care.
that's true. And
Yes.
so, speaking of that, exercise definitely improves your fertility for
Yes.
men and women. There's no question. And particularly women with polycystic ovarian syndrome, it's been shown that they need more vigorous activity
Mm,
in order to balance their reproductive cycle. So,
yes. Right.
people have to make this part of their lives. It used to be that people did a lot of manual labor, and they were healthier. They were healthier because of that. But now, a lot of white collar jobs, sedentary jobs, we sit in front
Yes.
of screens.
Yeah, you sit in front of screens, you do your work from home on the Zoom, and yeah, you don't go outside. You don't go to the gym, right? And then you eat junk, right? So yes, you're right. I would love to know the statistic of the people that are doing it, that are running in the winter and going to the gym and every day. And there are some people like Dr. Tia and Tony Robbins and some of the most of the people that's in your ear, they are going after that because they need the energy, they need they've got a goal, and they're trying to teach others that if this is what you want to get to, this is what you've got to do, which is why the coaching industry has just blossomed, right? But then you
Yeah.
coach people and they're motivated for a little bit and then they drop off because they're not naturally motivated. But yeah, I walk. I walk a 5K. It doesn't take a lot out of me. I just love it and I walk.
Mhm. Well, you're so
But
lucky to be in Florida.
I know, right? Yes, I'm lucky to be in Florida. So I walk and and then I read Dr. Tia's book and he says you need strength training, you need to go to the gym and you need to have a VO2 max and all this stuff. And I'm thinking, oh yeah, I know I should.
You
So
know,
now I go to the gym once a week because I'm getting in a little of the strength training. But I know that walking is my longevity thing because there's so many benefits of it. And I'm in the sunshine and breathing the air. And at least that's what I do. It's not the best, but it's
mhm.
okay.
I think walking is an excellent exercise. And I'm not saying everybody has to exercise themselves to death. In fact, over exercise is not good for you, can stress
Right.
you, and is bad for fertility.
Mhm.
Um, I'm just advocating for regular movement that gets you out of your seat. So whether it's walking, whether it's fast walking, whether it's, a treadmill, there's various, you can find something
Yeah.
that appeals to you, because there's many, many different sports and things that you can do. And even in the winter, I used to ski and skate, when my kids were small. And I must say, once they grew up, it's like, oh, I don't want to go out there. It's too cold. But there's other things I can do. And I have a gym in my home, and that's a really important part of my
Brilliant.
life.
Yes, though. Good for you. Yeah.
Yeah.
And my mom still lives my mom is 88 and she, walks every day. And that's why
Mhm.
she's 88 and healthy. But in the
Exactly.
wintertime, not recently, because she's a little older now, but maybe a couple years ago, maybe even 5 years ago, in the winter, she would just go walk the mall because it's indoor. And the malls
Mhm.
are like, you walk forever in those things.
That's right. Yeah. There's a lot of mall walkers, elderly mall walkers, who do that
Yeah.
in winter here.
And I think you're
That's,
right. Some of them even have
yeah.
groups, which is
Yeah.
good. You go and you meet up and you walk. But yeah, so there's ways around it. I mean, this elderly is not going to go to the gym. Even though in Florida, our gyms are filled with I'm assuming the snowbirds and people that live here. But yeah, so because they've gotten the message that
Hmm.
yes, if you want to live health span, which is the new buzzword, instead of
Hmm.
lifespan, exercise is very, very important part of it. And of course, eating, right? And sleeping, not just forget that. But they're the trifecta. You have to have them all. Okay.
Yeah. Sleep is super important. Not
Yes.
only amount of sleep, but quality of sleep,
Yes.
timing of sleep. A lot of people have undiagnosed sleep apnea and don't realize it, and they're not getting good sleep. We need to focus on this much more and educate people much more. I think, especially young people who are trying to build a career will often burn the candle at both ends. And, they're trying to get ahead in their career, which is good, but their life is out of balance.
Yeah.
And that actually adds stress to the whole situation, whatever
Yes.
the way that
Stress
you
to your bodies, right?
stress to your body, stress to your
Mhm.
brain, and the way you respond to stress is a really important factor. It's been shown that women under more stress, men under more stress, have lower fertility rates. There's no question.
Yeah, yeah. Well, that's good. I'm glad we're not just blatantly blaming the pill. I love it. Because if you think it's the pill, then you're not going to do all these other things. So that's amazing.
Yeah.
Now, I spend a lot of time talking about trauma on this show. So let's see if there's a link between, trauma and infertility. So, for the women that had trauma, childhood trauma, let's be specific, or maybe even young adulthood trauma. Um, uh, how does their reproductive cycles, you know, I don't want to
Yes.
say benefit, but the other word, um, uh, how
Yes.
does
How
how
does
does
it
it
affect your
affect their
cycles?
reproductive cycles? That's a better question, right? Mhm.
So when you suffer from trauma, from remembering traumatic episodes that come back to you, that affects your cortisol and your norepinephrine. And those hormones can affect everything in the body. The uh, those are hormones that are meant to be short term to deal with a specific situation. Like in the caveman days, the saber-toothed tiger. You want your cortisol up, your norepinephrine up, so you can run away or fight with the tiger or something. But what trauma does is expose you to that chronically. As your mind goes back to your traumatic situation, you keep pumping out those hormones, and what those hormones do is prioritize your survival, and reproduction is not necessary for your survival. So
Mm,
women who are stressed a lot will lose their cycles quite often, like stop having periods, because the body's saying, no, you need to survive this. You having a baby is not a good thing at this point. And I think people need to use that perspective more in seeing what their situation is, because this can be a huge factor in terms of your fertility. So I think if you're having trouble getting pregnant, you maybe should think more that your body may be protecting you from
mm,
outside influences and
mhm.
telling you it's not the time to get pregnant until you change something in your life, whether it's dealing with the trauma or whether it's, you know, improving your food and your activity and your sleep.
That's true. That's true. That's the best takeaway. That's the best takeaway. Right. Right. And don't necessarily blame it on your husband's sperm count.
That may be another thing because he might have trauma too.
That's right.
So,
Yeah.
mhm.
Right. All right. So let's talk about your book now. Your book is called Optimize Your Fertility Naturally. What's the main message of your book? And then you can tell our listeners how they can pick up a copy and also connect with you after the show.
Yeah, so the main message is that you have the power to improve your health and improve your fertility through that. And these are the ways that you can do it. I wanted to show evidence-based lifestyle changes, studies that have shown that you do this in particular, you can improve your life. It's really meant to empower people as much as possible, because most people who are having trouble getting pregnant feel powerless, and you shouldn't. You really shouldn't. There's a lot of things that you can do. It takes some work, it takes some effort, there's no question. But I have seen, when I've explained this to people, and women who really want a pregnancy are very, very motivated, or some of them, they will just do everything. I have seen women just change their lives completely and influence their partners to change their lives, and then, get pregnant super quickly. And it's just wonderful to see. It's really a
Yeah,
blessing.
well, like I said earlier, if you want to have a baby, it is a very powerful motivator. It's a
Mhm.
very, that's why they're willing to borrow money, they're willing to spend hundreds and thousands, they're willing to go through. I mean, one of the books that I read was from Gabrielle Union. You're Canadian, I'm not sure if you know her, but she's a black actress here, and she got married to Dwayne Wade. And she tells me she in her book she talks about she went through nine for IVF treatments, nine of them, right? But then she had trauma. She was raped when she was 19 or something. So that's
Mhm.
probably what affected her body. But it didn't work out. After nine, they had to get a circuit. So
Mhm.
yeah, so um people, you're very motivated. That's what I'm trying to say. You're very motivated, and it's very painful to know that you want to be mother and you can't. you know. I have a very close friend that she got married. I think she was in 40 or something like that, and which was a bit too late. And she went through one IVF treatment, it didn't work. And every time I see her, she cries because she's now 67 or something. Every time I see her, she cries because she doesn't have a child, and it's something she wanted more than anything else in the world, and it never happened for her. So it's yes, it's a sore tongue, and it's very painful. And I'm very happy for the women that succeed at it, because you know, what if you can't carry one naturally, like I said, sometimes you get surrogacy, you adopt, but a woman that wants to be a mother, it's a very, very powerful motivator. Yes.
Yes.
I personally think as a mother, and you are a mother too, that it's one of the most exhilarating experiences in the world. I mean, being a mom
I,
is,
I totally agree with that. I mean, absolutely. But then I have a sister who never wanted children,
yeah,
and
there's some of those. Yes.
and I respect that completely. I mean, that's a choice that you make, and the way you want to live your life. You shouldn't. In a lot of cultures, you are almost forced to have a pregnancy. That's not good either. No, you
Right.
need somebody who really, really wants to do it,
Yeah.
and but hopefully can. And I really think that your attitude is also very, very important. If you tell yourself, "Oh, I can't, it's not working," that's not good either. You have to have a positive attitude, saying, "I can overcome this. I will learn how to do this. I will learn what my
Yes.
body needs and give it."
Yes. Yes. I agree. Right. Positive and intention and setting the intention and not expecting failure. It's very
Hmm.
true. In anything,
Yeah.
anything you want in life, you've got to, because if you say no, then the universe is going to hear you, and then it's not going to happen. So I agree perfectly. So your book is available on Amazon. And
Not
what's
quite yet. I'm
okay?
having it is just about done, but
Okay.
I'm not going to have a book launch till June. It's going to
Okay.
be in Dallas at a conference. I'm going to start pre-orders within the next month or two, but the information is all on my website, which is
Okay.
Dr. Marina OBGYN. It's drmarinaobgyn.com. And there's a wait list that you can put your name on. And there's also, I have a blog. I write a weekly blog on fertility issues. So you can sign up for that. And then everybody who's getting my blog, of course, will get all in the information about how to get my book once it's out.
Beautiful, beautiful. All right. So I'm glad I asked that question. Right. So, but yeah, listen. I mean, the information that we've talked about here today, it was very all encompassing, and it should give anybody that's listening that is in that fertility journey or plan to be, some hope that it can happen, and it doesn't have to be, because a lot of women, not a lot, but I don't know, enough, would say, I can't afford those fertility treatments. So they feel that there's no help for them. But you're saying that they can change some things naturally, what they eat, exercise, how they sleep, and improve the quality of their eggs, and then their husbands can do something to improve the quality of his sperm. So yes, naturally is good. So yes, this book would be very important because, of course, you would go into detail of what they can do, and then yeah, your blog is good because if there's something that you want, you have to get as much knowledge as possible. So you arm yourself with knowledge. Knowledge is power. Again, the
Power.
side of that is only power if you use it. But you need to have the knowledge, you need to have the power. And I become very knowledgeable because I sit on this show and talk to experts like you.
Mhm. Yeah, I mean, I must say, I love the idea of doing a podcast. I would love to do it myself eventually. Maybe I'll go and I'll ask for your advice when I get there.
Yes, of course, of course. Yeah, you have a lot of people tuning in. Yes, yes. It was very good because it's I think it's the number one women's issue right now. Like I said, when I was growing up, girls would just get pregnant. They don't want these kids and they just get pregnant. You just have sex one time and it happens.
Mm.
And now you're married for 10 years and it's not happening.
Yeah.
And you're actually trying, right?
Yeah, the world is
Yes.
changing, and it's quite scary. How low the fertility rates are in some countries. So places like Japan and North Korea, uh, they are going to see the changes. Well, they are seeing the changes that they're having so many more elderly people. Japan just started a program where they're bringing Indian immigrants to help look after their elderly because they don't have enough Japanese people to look after their elderly.
Wow.
So, immigration is going to be one way of dealing with this problem. But since the whole world is suffering from low fertility, they'll have to bring people from Mars, I think.
Yeah, yeah, I guess that's probably why the Trump administration tried to ban abortions because they want to help the fertility rates. Wait, yeah, which is another thing, right? There's some women dying to have a baby and some women are, trying to have abortion. And we're not going to talk about abortion, but I just thought I'd plug that in there.
Mhm.
Amazing. Well, I enjoy this conversation. I'm well past my fertility age, but I find this conversation fantastic, and it's inspirational to a lot of my listeners because my listeners are in that bucket, 30s to 50s, and
Mhm.
yeah, a lot of women are having problems with fertility. So I love having these
Well,
conversations, and of course, my daughter is 36, so so yeah, so I would be able
the
to
writing of this book actually started because my daughter, when she graduated from medical school, she turned 31 and she asked for her birthday if I would pay for her to freeze her eggs because she knew that she was starting a really busy residency and
Mhm.
wouldn't have time or whatever. And then that's what got me thinking, you don't want to freeze stressed, tired eggs because they're not going to be high quality. And that's what led to doing all the research for this book,
Oh, that's
basically
beautiful.
telling her this is what you need to do for my grandchildren.
I love that origin story. Yes, I tell you, we love being mothers and helping out. So amazing. All right. Well, listen, Dr. Marina, thank you for reminding us that knowledge is power and that women deserve compassion, whole person care when it comes to their bodies and their futures. So, if this episode spoke to you, ask yourself, what is one step I can take today to better understand and honor my reproductive health? You'll find Dr. Marina. Her last name is Straszek dash Siri. Couldn't say it, so I dropped that. And her book. The link will not be the book right now, but when the book is live, then I would go back and add it in. But definitely check out her website, which will be in the show notes as well as on the show page of Transform Your Mind, which is myhelps.us. And remember, when you renew your mind, you transform your life in every aspect, whether it's longevity, your fertility, whatever that you want to transform, relationships, everything. It starts with the mind and then you transform your life. So if there's one thing I want to leave in addition to what I just, my summary there is that yes, don't be defeated. Anything you want is worth fighting for. And if you want to be a mother, right, there are ways to do it. And if you approach it from a holistic point of view, then it might work for you, right? So as we close out, do you have any last words for listeners, Dr. Marina?
Well, I just wish you all a fertile future.
Yes, I like that. Right. All right. Well, listen, thank you guys for tuning in. Thank you, Dr. Marina, for being on the show. I definitely enjoyed this conversation. Until next time, namaste.
Thank you. Namaste.